States across the country continue to break records for new coronavirus infections. On Friday and Saturday, authorities tracked back-to-back cases of more than 80,000 infections before those numbers declined on Sunday. Hospitalizations across the country are also approaching near record levels. Former FDA Commissioner Dr. Scott Gottlieb spoke to our colleague Margaret Brennan about his concerns, and he issued a warning.
We're at a dangerous tipping point right now. We're entering what's going to be the steep slope of the curve, of the epidemic curve. We know what that looks like from the spring. We know what it looks like from the summer. These cases are going to continue to build. There's really no backstop here. I don't see forceful policy intervention happening anytime soon. We have a moment of opportunity right now to take some forceful steps to try to abate the spread that's underway. But if we don't do that, if we miss this window, this is going to continue to accelerate, and it's going to be more difficult to get under control.
Let's bring in Dr. Ron Elfenbein. He's an emergency care physician and author of Surviving Coronavirus, an ER Doc's Perspective. Doctor, you heard Dr. Gottlieb's concerns. We've seen record-breaking numbers over the weekend. Here's what the president has been saying, and here's what the president tweeted earlier this morning. Cases are up because we test. A fake news media conspiracy. Many young people who heal very fast. Corrupt media conspiracy at an all-time high. Doctor, for people who may be wondering, yes, we are testing, but the testing over the last 3 or 4 months has remained relatively flat, and yet hospitalizations are going up and the death rate is climbing. Can these numbers be explained away, as the president keeps saying, by simply testing?
Well, I don't think so. I think that there clearly is a rise in the number of cases, which, again, we've talked about this before, Vlad, is to be expected. You know, you look at the fact that the weather's getting cold, people are starting to go indoors more, being around other people more as sort of we relax our restrictions and things like that. And, you know, we talk about complacency, people becoming a little bit more complacent perhaps. And as all these things happen, we would expect that the number of cases would rise. Furthermore, we know that coronaviruses historically are more active. The other coronaviruses are more active in the cold weather seasons, which we're going into in all of the United States, as well as the fact that all pandemics, historically speaking, have a second wave, which is larger and worse than the first wave. And I have to believe that this is kind of the beginning of the second wave. So I don't think we can explain it all the way as simply just saying, well, we're doing more testing. Well, it is true that as we test more, the number of people that are going to be positive are going to go up because just that you're testing more. I don't think it's that simple, and I don't think you can explain it away that easily.
Doctor, the numbers are rising, particularly in areas like Iowa, Minnesota, Wyoming, the Dakotas. These are areas that are more rural than where we saw sort of the initial spike. Hospitals are being overwhelmed. Can we talk about why we believe that the spikes are happening in these areas now as opposed to before? And are they going through their first wave, or is this also the second wave for these more rural states?
Yeah, it's a great question. I think part of it is that, you know, you see in the rural areas people being less vigilant about wearing masks and social distancing and things like that. I don't want to put all the onus on individual people, but I think there is some degree of that is accounting for this. The other thing is, as you point out, Anne-Marie, yeah, sure, this is very possible that this is their first wave, and they're, you know, everybody's kind of got to get hit with it at some point, and these rural counties and rural areas are getting hit. I would point out to your viewers, however, that it's very different from one county to the next and one area to the next. Again, it's not all rural counties are getting hit and all rural areas are getting hit. Certain areas in Minnesota, for example, are getting hit hard, while other areas are not. Certain areas in Oklahoma are getting hit hard, while other areas are not. So it's, you know, it could be that one small town in Minnesota, they had a wedding with lots of people, and some people came in from out of town, and, you know, there's only a few hundred people in that area, and 20 of them caught coronavirus. So that as a percentage of the whole is much higher than it would have been. So you kind of have to look at it on a case-by-case basis. But in general, cases in the Midwest, for example, have gone up about 60% in the last 2 weeks compared to about 35% for the rest of the country. So again, it's dependent on which county you're talking about and which area you're talking about, but it is concerning. And I think some of this has to do with the fact that there is this degree of lack of vigilance on people's parts in some of these areas.
Yeah, I mean, you know, there's been shown to be a correlation between governors and states that chose not to lock down at the same time, for example, as New York locked down, and have been lackadaisical when it comes to the wearing of masks. The other
Yes.
sort of interesting point, Doctor, is the CDC released some new guidance last week about close contact, saying that a close contact is someone who is within 6 feet of an infected individual for a total of 15 minutes or more over a 24-hour period. So how will that affect schools and those who work on site?
Yeah, so they changed the definition. It used to be 15 minutes of consecutive time. Now it's 15 minutes of cumulative time. So clearly that's going to make people sitting together, working together, schools, as you point out, Vlad, much more difficult for people to gather and do what they need to do. For example, in schools, kids have to be more than 6 feet apart now. Otherwise, you're breaking CDC guidelines, essentially. Same thing with at work. People have to now be 6 feet apart or more because it's got to have to be 15 minutes over a 24-hour period. So this is going to make opening up schools that much more difficult, opening up businesses that much more difficult. This all came from an outbreak in a prison in Vermont, actually, where they discovered that these people, the guards and things like that, people that work at the prison had a cumulative exposure rather than a consecutive exposure. So the CDC kind of changed it based on that, which, again, it becomes very problematic for opening things up like schools and businesses.
Johnson & Johnson's coronavirus vaccine trial is set to resume after an unexplained illness in a participant. Investigators concluded that the individual's illness did not appear to be related to the vaccine. We've seen some hiccups with some of the other trials as well. And, as sort of an outsider, I don't know what that means. I don't know if this is just par for the course. This is how things, work out, that eventually, that with most, the development of most vaccines, there's going to be a time when things need to stop, they need to reassess, and they pick back up again. So based on some of the stuff that we know about the various vaccine trials, how optimistic should we be about a vaccine, getting one maybe by, next year?
Yeah, that's a good question, Anne-Marie. So first of all, I think your viewers need to understand that this is very common. The clinical trials oftentimes will shut down because something happens to somebody. Now, remember, it's incredibly stringent. The guidelines on these things are incredibly stringent. So, for example, you brought up the Johnson & Johnson vaccine trial. Interestingly, the Johnson & Johnson vaccine is the only one of the major ones being put forward that is a single dose. So it's very important that Johnson & Johnson, if this is truly an efficacious vaccine, gets the EUA, the emergency use authorization, as soon as possible, because unlike the other ones, it's a single dose as opposed to multiple doses. But so what happened with this one in particular was on October 12th, a young participant in the trial, of which there have been over 100,000 volunteers getting this vaccine, but one person and one person only had essentially a stroke, and they paused. Rightly so, they paused the entire trial, and they looked into it. The Institutional Review Board looked into it, which is a governing body that is totally separate from Johnson & Johnson, that is overseeing it to make sure it's safe and that nobody's getting hurt and that everything is being done properly. They've basically found that this was totally unrelated to the vaccine, and they are looking to restart the trial. But again, it's one person out of 100,000. The same thing happened with AstraZeneca. AstraZeneca paused their trial because somebody had an episode of a neurologic problem called transverse myelitis. This was back in early September. And they paused their trial, but then immediately thereafter, like a week later, Brazil, the United Kingdom, South Africa reopened the trial, and then a couple of weeks later, Japan reopened the trial. The United States is just thinking about reopening the trial this coming week because the FDA really wanted to be sure that everything was safe and okay. But again, this is very common. These kinds of shutdowns, you see, one out of 100,000, they shut the trial down. It's very common. It's not unexpected, and I don't want anyone to read too far into that. It doesn't mean that this is an unsafe vaccine. It doesn't mean it's a bad vaccine. It just means that somebody had bad luck, basically. And while they were getting the vaccine, they happened to have a stroke, which presumably they probably would have had otherwise, even if they weren't getting the vaccine. Now, I don't know that for sure, but again, the IRB and the governing bodies looked into this and determined that the two things were completely unrelated.
All right, Dr. Ron Elfenbein, thanks for giving us some perspective there. We appreciate it. Thank you.
Thank you.